So I think a very first step is to understand tasks better and to really try to perform task analysis, which requires them to talk to people who have the expertise to perform those task analysis, human factors, to get human factors involved. So this is one important step, I think. And I think infectious diseases, infection prevention and control is a huge opportunity for people like us, human factors engineers and human factors specialists, to come in and to help understand the tasks better. I think that's the first step, to get actually additional expertise and to think about tasks. The next step is to ask how feasible are expectations about task performance. So how realistic is it to expect a protocol being followed in the clinical context? How much do we evaluate actually if this protocol is really feasible or not and sustainable in its execution or not? So that's testing the reality really in the context of performance. Not only writing a protocol on the desk and say people will follow it, even with the expertise of a subject matter expert, but really assessing how it can be followed in the clinical context. It's another thing. A third thing I believe is that we want to think very hard about the equipment that is being used currently and how the equipment can be used smarter and how we can actually ask questions about the usability of the equipment that is currently being used. Often equipment, despite manufacturers' claims to the opposite, is not high in usability. And understanding more about those problems, that when equipment is poorly designed, it leads to performance breakdowns. Understanding more about those contributors to performance breakdowns and ultimately increased infections, for example, is an important other component in all of this. So leveraging the expertise that human factors can provide, I think, is an important thing that can be done right now. And then I think the more interesting tasks in the future are trying to get more input on equipment development, trying to standardize certain types of equipment and develop kits that actually guide people through the tasks that they are performing.